Hello, dear elephant lovers. Welcome back to another heartwarming treatment mission carried out to save a poor young elephant. This video shows the treatment of a wild elephant who was injured by both a gunshot wound and a snare trap. This poor elephant was first noticed by a woodcutter who had been passing by. He noticed the isolated elephant with unusual behavior. That is when the Wildlife Conservation Office got an urgent call for help. The woodcutter explained the elephant was limping. Additionally, he mentioned the elephant was isolated and attacked anyone who passed by. Then, an experienced team of veterinarians and wildlife conservation officers responded immediately to provide the emergency assistance needed. These officials understood that if the elephant did not receive proper medical treatment, its condition would quickly worsen, so they acted quickly. The veterinary lady doctor and her crew had to travel on a challenging path to reach the injured elephant. To get there, they bravely and courageously crossed a massive fallen tree that stretched across a river. Their hard work and dedication demonstrate their deep desire to help and save these gentle giants. Not only that, the kind villagers also joined the officials to help save the poor elephant. Elephants can be extremely dangerous when approached by humans, especially if they feel frightened or wounded. Despite their generally peaceful behavior, these wonderful beings will immediately defend themselves from potential attackers. When an elephant is injured, its sense of danger increases, making it more likely to respond aggressively when humans are present. That is why the doctor decides to sedate the animal as the very first step in the treatment procedure. A mild dose of anesthetic drug was darted to the elephant intramuscularly using a tranquilizer gun. An official starts cleaning up the surrounding area to remove any trees and shrubs. Now, after about 15 minutes, the elephant shows clear signs of sedation. So an official gets closer to confirm the animal is sedated. Yet the officials acted carefully and calmly to avoid any distractions or aggressive behavior from the elephant. This is a young male elephant, approximately 15 to 16 years old. That leads us to an educational question. How can we identify and confirm the elephant is sedated? There are a few obvious symptoms and side effects to look for. The penis erection and the elephant may pass urine. The head bends forward while the trunk reaches the ground. The elephant remains motionless, with flapping ears. After confirming the elephant is sedated, it is now time to start the treatment process. The elephant's eyes were covered with a cloth to make sure the elephant didn't see the officials roaming around it, because that could be a huge risk to the officials and the animal. A team of officials was assigned to inject the required medicine intramuscularly. Antibiotics, multivitamins, painkillers, and anti-inflammatory drugs are some of the medicines that are administered. At the same time, another official was assigned to treat the gunshot wound. Both procedures were carried out simultaneously. All the officials involved are well trained and experienced in dealing with such situations, having successfully treated many animals in the past. The gunshot wound is severely infected, resulting in swelling, and the elephant's life is in danger. Please note, the following footage shows a real medical procedure on the elephant's injured leg. While it is an important part of the healing process, some viewers may find it sensitive. At first, the wound is cleaned using saline solution and cotton wool. This process removes the maggots, pus, necrotic tissue, or any bullet particles lodged within the wound. Then, a disinfectant solution is used to clean the wound. A syringe was used to inject it. The officer used forceps and cotton wool to clean the wounded area more deeply. Then, a syringe is used to inject a solution of povidone iodine and negacid powder into the wound. The same treatment procedure was carried out to treat the wound on the other side of the leg. The veterinary doctor and the officials carefully examined the injured elephant and confirmed that this poor animal had fallen victim to both a gunshot and a snare trap. They believed the elephant's trunk might have been caught in the snare trap earlier, but the cable noose had fallen off on its own, and the wound had healed naturally. Unfortunately, the elephant then faced another cruel incident, which was a gunshot. The bullet had penetrated through the leg and came out from the other side, causing severe injury and pain. As the final step to treat the wound, the anti-fly spray is sprayed on the treated wound and the injection sites. Now, the treatment process is completed, and the revival drug was injected through a major ear vein. These are the disastrous consequences of human arrogance and selfishness. Human-elephant conflict over limited resources is usually the root cause of these situations. As elephants may appear on agricultural grounds in search of food, angry farmers may be tempted to use illegally handmade weapons to shoot these poor animals to protect their sources of income. However, this approach not only hurts the elephants, but also worsens human-wildlife conflict. As a result, the government has implemented rules to protect these animals, and wildlife conservation officials conduct awareness campaigns throughout the area to educate people about the terrible consequences of such inhumane acts. Not only that, but deep investigations are carried out to identify any criminals who perform such risky acts. The officials headed back on the same challenging path. We would like to thank all of our viewers, the veterinary doctor, veterinary officials, wildlife conservation officials, the woodcutter who informed us about the incident, and all the others who were involved. Let's meet again with another interesting video.